Do you know anybody with ADHD? Or do you have a child with ADHD? Or have been told about a family relative who has somebody who could potentially have the symptoms of ADHD? And you're worried about treatment, and for most parents, when they think about treatment of ADHD, they think about the side effects, and they talk about, I don't want my child to become a zombie. Over the last 20 years, I've heard that so often. And it's really sad that the thought of the side effects and the potential side effects of medication can prevent parents from getting really important, life-changing treatment. So I'd like to talk about and demystify the concept of an ADHD child becoming a zombie. In 20 years of treatment of children, and I have used a lot of medication in combination with lots of other important treatments, I have never had a patient who's become a zombie, who's lost their personality, and to use a more recent term, flattening the curve of the personality. It really depends on a couple of things. Medication, any medication, can cause side effects. It is as important for a doctor to know as much as they can about the medication as they know about their patient. The treatment of ADHD depends on communication between doctor, parents, school, and of course the child. For 80% of children, the medication is magic. It has so few side effects. It is one of the most effective treatments for any psychological or mental health disorder. It is as effective in treating the symptoms of children with ADHD as effectively treating someone's tonsil or tonsillitis with Augmentin. It can be absolutely life-changing. To see how parents struggle for many years, performing other types of investigations, wasting their money on expensive, alternative, less effective treatments, and land up wasting and delaying time when their child could get really, really effective treatment. Effective treatment means investigating, going to somebody who knows and understands the medicine. You know, I was chatting to one of my patients who's an attorney, and as he said, you know, not all attorneys are specialists in conveyancing and dealing with properties. And that's very similar to doctors. Doctors who specialize and spend their time dealing with one particular problem are much better at it. They understand the medicine, the nuances, they get a feel for the medicine. So I would really encourage parents, find yourself a doctor who understands the medicine. The medication starts to work in literally 1 hour. And the effect of that medication is dependent on the type of medication used. But in South Africa, we've got stimulants and non-stimulants. And the first line treatment is often the use of a stimulant. Parents are worried about addiction, being hooked on the medicine. And you know, if the child is carefully assessed and the risks are carefully assessed, that medication does not make the child lose their personality. There are children who do not respond well to the medicine, and that needs to be really picked up early. So the relationship between parents, child, and teacher, picking up those symptoms at school, making sure that the teacher gives feedback while the child's on medicine. And when you start on the medicine, have a look, monitor, ask your child. When I review children after their trial of medication, I spend a lot of time talking to children because they're the ones that can tell you honestly. Parents will observe things and they will also be able to give feedback. So don't worry about necessarily your child becoming a zombie. As long as you're going to the right doctor, it's well monitored, it is life-changing. It is one of the most effective treatments we have for the treatment of behavioral problems. And imagine your child who's struggling at school with learning problems, as well as ADHD. Without getting proper treatment, concentrating, helping their working memory, their executive functions, it makes that treatment and those interventions like speech therapy, occupational therapy, and even specialized education much less effective. So think about next time when you hear the word zombie. It is something that really is not something that we see, and they get the right help from the right doctor, and they're well monitored.